All right, my name is Ryan Dickerson. This is the exam for lab review. This is meant to give you some high yield review structures to look at right before you go into the practical exam. This is brought to you by Scrubs. You all know the mission statement for Scrubs by this point. Student-driven initiative aiming to develop supplemental resources for current and future cohorts that will pass through Brody. If this is something you're interested in joining, we are always looking for members to join the community and help us get back to the community that we are all so happy to be a part of. And then disclaimer, these are supplemental resources made by students, not by faculty, so there could be errors. We all understand where that comes from. Additionally, this is a supplemental resource and not a primary resource, so it doesn't replace Brody faculty. I'm going to give out an additional disclaimer here that this resource is meant to give high yield structures, and it does not cover nearly everything that you'll be tested on your practical. Okay, so as I said just a moment ago, this is meant to be a resource to give you some high yield structures that I would know before you're walking into the practical. This is a list of almost everything you could be asked to identify. The things in red are things that I would say do not walk into the room for the practical exam without having at least looked at this in some way or fashion or have some familiarity with. Okay, but again, everything that you've been asked to identify, to dissect, to read in the course pack, read in the dissector is testable material. I will not cover all of that there. I will not cover all of these highlighted terms here. Right, I'm just going to try to cover some of the big structures. Again, there are also structures that I can't cover based on it being an image and not being able to get the 3D relationship that's shown in lab. Okay, so with that said, we're going to go through some high yield structures and just knock them out quickly so that way you can get a quick rapid review in before test day. So starting off in this region, let's get our orientation down. We have the uterus anterior, that means posterior we have the rectum. Up here is my abdominal wall. The things I want to point out here is you have the uterus. When you're looking at this region, make sure you're identifying the uterus and then immediately look for the fallopian tubes. So here are the fallopian tubes, which are then going to extend into fimbriae and then the ovary. So over here you can see the ovary, fallopian tubes coming around, giving off the fimbriae. So remember, for the fallopian tube, there are different segments. There is the fimbriae, which are little finger-like projections that open up into the infundibulum, then the ampulla, then the isthmus, before it goes into the uterus itself. The other thing I want to point out is there are pouches you're going to need to know. The pouch in between the pelvis and the uterus is a vesiculo-uterine pouch, because remember, the bladder is up here as well. So vesiculo-uterine pouch. Then between the uterus and the rectum is a recto-uterine pouch. So keep that in mind in females that you have two different pouches. Okay. I also want to point out the ureter here. The ureter is this structure right there. It is coming from above in the pelvis and running down. It is crossing over top of the common iliac artery and it's coming down, and it's going to be running down forward to the bladder. Remember, as it comes down, there is going to be a vessel that is going to cross over top of it, which we can't see in this image, but that is the uterine artery. Remember, water under the bridge. In females, the ureter passes underneath the uterine artery, and in males, it's going to pass underneath the ductus deferens. Here's just a quick review. Just wanted to put this out there. You do need to know the ligaments that are present within the broad ligament. So the broad ligament is here, but there are specific segments we need to know. We need to know this region connecting the uterus to the ovary itself. That is the ovarian ligament. There are no vessels within the ovarian ligament. There is a structure that is coming from above in the pelvis, running down to the first part of the fallopian tube, so the infundibulum. This is your suspensory ligament of the ovary. The suspensory ligament of the ovary is containing the ovarian artery and ovarian vein. Lastly, we have our transverse cervical ligament, also known as a cardinal ligament, which houses the uterine artery, which is highlighted now. So uterine artery. Other things from a superior view that you want to look out for, there is the uterus. Make sure you also pick up on the round ligament of the uterus. So this is anterior, this is posterior. The round ligament is going to connect from the fundus and run out into the inguinal canal, which you learned on your last unit. Here goes the suspensory ligament of ovary going to the infundibulum, and there goes the ovarian ligament. So in this in this ligament, you're going to have the ovarian artery, ovarian vein, and then nothing in the ovarian ligament. And then not shown, the transverse cervical ligament would be down in this region. That is going to house the uterine artery. Okay, so actually seeing that on a cadaver, again, here's anterior, here's posterior, identify the uterus, bladder, here's my common iliac coming out, so this was aorta. And there goes the ureter, crossing over top of the psoas muscle, which I'm highlighting now, crossing over top of the external iliac branch, coming down, passing over top of the internal iliac branch. It's going to run up and go to the bladder. Okay, so again, we can see the ovary, and then we can see the different components of the fallopian tubes. There goes the fimbriae, the little finger-like projections, infundibulum, ampulla, isthmus. Okay, and then again, we mentioned the vasculature that we can see here. Okay, now talking about the vasculature within the pelvis, this is often difficult for students. There are a couple of key things that I want to be able to point out. First, we got to identify region when we're coming up in this region. So first, look at the cross section. Know that this is going to be medial. You're cutting through the sacrum and the pubic symphysis. So this is medial, and you're looking through the pelvis to the lateral wall. So here, big organs first. You have the bladder located anteriorly. Behind the bladder, we have the uterus. Here goes the uterus. And then down at the base of the uterus, you see this canal. This is the vaginal canal. At the top of the vaginal canal, connecting to the uterus, is going to be your cervix. So there goes your cervix there. As we come up, again, we have the ovary and we have the fallopian tubes. The ovary is connected to the uterus via that ligament right there, which is your ovarian ligament, which does not have vessels running through it. Okay. Now, here goes our common iliac, and let's follow its branches. Common iliac goes out, external iliac, and then comes in, internal iliac. We know the internal iliac is going to bifurcate into an anterior and posterior division. Highlighted now is the posterior division. This is the posterior division here. Now here is the anterior division. So off of the posterior division, what I think about when I'm looking at this in lab, I find the internal iliac and I say, oh, this is going posterior, and I follow it to its termination. It's going to go out of the pelvis. This vessel that goes out of the pelvis is going to be your superior gluteal artery. So here we go, superior gluteal artery being highlighted now. Then I need to know what other vessels are coming off in the region of the posterior division. Well, the first vessel I should see coming off should be my lumbosacral, iliolumbar. The iliolumbar vessel. That is going to be highlighted here, and then the next two are your lateral sacral. So iliolumbar, then lateral sacral. There could be one lateral sacral, there could be multiple. In this particular cadaver, there's two. Okay, so that gives me my posterior division. My anterior division, I want to follow down, and I want to find out where are those two terminal branches going. So the anterior division comes down, and it's going to give off two terminal branches that are exiting the pelvis via the greater sciatic frame. This is going to be your inferior gluteal artery, I'm highlighting now, and then your internal pudendal artery. Okay, so coming down, inferior gluteal, and then your internal pudendal. Okay, other things, everything else that comes off is coming off the anterior division. What you're looking for here is just track it back to say, does this definitively come off the anterior division? And if so, where does it go to then? So I'm going to be identifying things based off the structures they run with. So look at this vessel. Here is a vessel. I can see it coming off right here, off of the anterior division. It's coming down, and it's going in this region. Well, this is going to be the region of the uterus, right here. Also, I see it's passing over top of the structure I'm highlighting now. The structure I'm highlighting now is a ureter. So there is an artery coming from the anterior division going to the uterus. It crosses over top of the ureter. That tells me this is going to be the uterine artery. Right here, I see the obturator nerve coming through. Obturator nerve going to the obturator canal to exit the pelvis. If there is a vessel running with it, that would be the obturator artery. Okay, it's probably this vessel right here that we can't see tracking up. Okay, but vessel ending up in this region is going to be obturator. Here we have a vessel coming down. It isn't going to the uterus. It's going down a little bit further. This is going to be my vaginal artery. Okay, so vaginal artery. Okay. I think those are the big things I want to see here. We'll keep on moving. Okay, so now we're looking posteriorly. So we got to get our orientation down. Here is medial. This is my anus, the anal canal right here. And over here is lateral. The big things that I want to point out here are the ligaments. You're just as likely to be asked the ligament as you are the muscles. So the ligament that goes from the ischial tuberosity, which is located here, to the sacrum, is your sacrotuberous ligament. Sacrotuberous ligament located here. Okay, the ligament that's located more internal, going from your ischial spine to your sacrum, is your sacrospinous ligament, highlighted here. So sacrotuberous ligament, sacrospinous ligament. Other structures that I want to point out here is I find the piriformis, which is located here. Here goes your piriformis muscle. I know the vessels going, or the nerves going out underneath the piriformis must be the sciatic nerve, the posterior cutaneous femoral nerve, the pudendal nerve, and your inferior gluteal nerve. So coming down into the leg, that is your sciatic nerve. Okay, the vessel that comes out and is going to the gluteus maximus, the vessel and nerve, that is going to be your inferior gluteal nerve. Here it's just cut because the gluteus maximus is reflected. But I do see that there's a structure that comes out, wraps around posteriorly to this sacrospinous ligament, which we already identified. So it comes around and then it disappears. It disappears because it's running into the pudendal canal, which is on the obturator internus muscle. So there right here is our pudendal nerve. So recognized in lab, you could be asked the nerve and artery, and you can also be asked the ligament that it passes over top of. So there you go, pudendal artery and nerve coming down, and eventually it's going to give off these branches to the external sphincter. This is your inferior rectal branches. And as we continue down the leg, we're now looking at the musculature in the femoral triangle. When you see the femoral triangle, go ahead and identify the borders first. We have the inguinal ligament located superiorly. We have the adductor longus located more medially. And then we have the sartorius located laterally. You can see the same things in this image. Within the femoral triangle, you need to know structures from medial to lateral and lateral to medial. So the most lateral structure here is going to be the femoral nerve. Next, we have the femoral artery and then femoral vein. The floors of the femoral triangle is going to be the pectineus muscle medially and the iliopsoas muscle located more laterally. This is the floor of your femoral triangle. There is a nerve that's not in the femoral triangle that's located a little bit more laterally. This is your lateral cutaneous femoral nerve. Lateral cutaneous femoral nerve here. Okay, what muscle is this up in the hip? This is your tensor fascia lata. It's coming down around the leg. And then again, here's our sartorius. The muscle is located here. This is my rectus femoris. Okay, so as I come into a more blown out section, we can see the same things, but here what we've looked at is we have now removed the layers of the adductor canal. The adductor canal, remember, is bordered by the sartorius muscle coming above. So sartorius muscle here. The sartorius muscle normally would be running right in this region. It's just been moved over a little bit. And then we have the vastus medialis muscle located here. That forms the lateral border of my adductor canal. The medial and posterior borders of my adductor canal are my adductor longus and adductor magnus located here. So longus, magnus. The nerves that run through here is what I want you to keep track of. There are two nerves that run through the adductor canal. You have the nerve to vastus medialis and you have the saphenous nerve. The nerve to vastus medialis is going to come down and it's actually going to pierce the muscle. So it comes down and pierces the muscle. The saphenous nerve is going to continue because it has to get into the medial leg because it's going to exit down the knee and do cutaneous innervation from the knee down on the medial aspect of the leg. Okay, so the two nerves that are running through the adductor canal is going to be the nerve to vastus medialis and the saphenous. Okay, again, here we're looking at vasculature. I'm going to start over here with this image. We have the femoral nerve. The femoral nerve is a continuation of the external iliac. The external iliac changes name to femoral when it passes underneath the inguinal ligament, which we see here. So as we come down, we're going to get the main branch of the femoral nerve going down. It's going to go through the adductor canal, and they're going to exit through the adductor hiatus to get into the popliteal region. But here's the posterior division. So this posterior region is called the profundus femoral artery. Profundus femoral artery comes down. It's going to continue down. And it's going to give off perforating branches. What we need to know is that there is a branch that comes medially and a branch that, this is lateral. A branch that comes laterally and a branch that goes medially. The branch that goes laterally is called our lateral circumflex femoral artery. The lateral circumflex femoral artery has three branches. It comes off and then it's going to give off an ascending branch, which is going up, a transverse branch, which comes out laterally, and then you're going to have a descending branch, which runs down. So the lateral circumflex femoral artery, again, giving off three branches. Over here, not really being able to be seen, is your medial circumflex femoral artery. Okay, important to know that the profundus femoral artery is passing between two muscles. It is passing between your pectineus muscle, right, and your adductor longus muscle, passing right between the two. Okay, so this is the profundus femoral artery. Over here, you can't really see the rest of the superficial arteries that you need to know, but the three arteries that you need to know coming off superficially from the femoral artery are going to be the superficial epigastric, the superficial circumflex iliac, and the external pudendal. Okay, so external pudendal would come off and it would go towards the gonads. The superficial epigastric would run up, and then the superficial circumflex iliac would come around towards the ilium. Okay, other big structures here, you know that you have the great saphenous vein, which is coming right through here, right, entering into the saphenous vein via the saphenous opening. Okay, posterior region, again, glute maximus. If I dig in deep, the big structures here you want to be able to identify is the piriformis. That's one major landmark. The other major landmark is the obturator internus tendon. So piriformis muscle coming out, obturator internus tendon located right here. The muscle directly above the obturator internus is going to be your superior gemellus. the muscle located directly beneath the obturator internus is your inferior gemellus. The superior gemellus and the obturator internus are innervated by the same nerve. The inferior gemellus and the muscle located beneath it, the quadratus femoris, are innervated by the same nerve. So you've got piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Now, the big thing about identifying these muscles is these muscles are a way for you to recognize where the greater sciatic foramen and lesser sciatic foramen are. The piriformis muscle passes through the greater sciatic foramen. So if it passes through the greater sciatic foramen, the nerve and artery that comes out above the piriformis muscle through the greater sciatic foramen is your superior gluteal artery and nerve. So this nerve located here is the superior gluteal nerve, and the vessel running with it, superior gluteal artery. Down below, that gives me my sciatic nerve, the posterior cutaneous femoral nerve, which I'm highlighting now. You have the pudendal nerve, which is in this region here. And then we have our inferior gluteal, which we can't see because it's attached to the glute, which has been removed. So it's one of these branches up here. Okay, so make sure you know, based on the piriformis, if anything comes out above it, superior gluteal, done deal. Everything else should come out below. Obturator internus tendon is the only structure that passes through the lesser sciatic foramen to leave the pelvis. Okay, it's got the superior gemellus and inferior gemellus on either side. As I continue down further into the leg, here we're looking at the popliteal fossa. So in the popliteal fossa, remember that our borders are going to be the heads of the gastroc. We have a medial head and a lateral head. And you say, Ryan, how the hell did you know that this was medial versus lateral? There's two ways that I figured that out. One is I looked and I saw this long tendon coming down the leg. This is going to be the semitendinosus. It has a very long tendon, which I can see here, going to the pes internus. The other way that I figured this out is I looked at the nerve. I said there's a nerve coming down, there's a branch that goes straight down the middle, and there's a branch that comes around the outside of the leg. I know that the sciatic nerve is made up of the common fibular nerve and the tibial nerve. Tibial nerve continues straight down. Common fibular nerve goes out around the fibula, which is the lateral aspect of the leg. So that helped me identify lateral aspect here. Okay, so this is all the popliteal fossa. Do know that the structures from superficial to deep in this region are going to be the nerve, so the sciatic nerve, then the popliteal vein, and then deep to that, your popliteal artery. Okay, and now I also want to point out the tibial nerve and the common fibular nerve are going to give off a common branch, which is going to be the sural nerve. This is a cutaneous branch. It is not doing musculature, it is doing the skin on the posterior aspect of the leg, as well as the lateral aspect of the foot. Okay, so this is your sural nerve, getting contributions from both the common fibular as well as the tibial. Okay. All right, then over here on this image, here we're looking at the posterior aspect of the thigh. In the posterior aspect of the thigh, like we said, we need to identify medial and lateral. So this is lateral over here, this is medial. I'm doing this because I can see the tensor fascia lata up here, indicating the lateral aspect. This muscle coming down is the long head of the bicep femoris. How do I know it's the long head? Because it's arising from the same region as these other muscles, which is the ischial tuberosity. This muscle is innervated by the tibial nerve. Down below it is the short head. The short head of the biceps femoris is innervated by the common fibular nerve. Over here laterally, I have two muscles. One is located more medially than the other. The more medial of the two muscles is the semimembranosus. The semimembranosus, the M for medial, it's the most medial muscle in the posterior compartment. So the long-headed bicep femoris, semitendinosus, and semimembranosus are all innervated by the tibial nerve. The short head of the bicep femoris is innervated by the common fibular nerve. Okay, so again, we're in the popliteal region. We see the nerve, which is most superficial, coming down. It's giving off the common fibular, and then the continuation, which is the tibial nerve. Underneath that, we have the vein, and then deep to that, we have the artery, which is located here. So the artery coming down. The big thing that I wanted to point out about the artery is that as the artery is coming down through the knee, it is giving off branches both medially and laterally. Okay, so medial branches and lateral branches. If they're above the joint, they are called superior genicular arteries. If they are below the joint, they are called inferior genicular arteries. So all you really need to know is it above or below the joint. Okay, so this would be my medial superior genicular artery, and then down here inferior, or in this region, inferior genicular artery. Medial genicular artery. How do I know this is medial versus lateral? Same thing I did before. I'm looking at the common fibular nerve going out laterally. I can also see the popliteus muscle. Okay, so now I'm getting down to legs, superficial. You need to know the small saphenous vein. Small saphenous vein runs around the lateral aspect of the foot. It drains up, and it's going to drain into my popliteal vein. There is a nerve running with it. That is your sural nerve. As I come down posteriorly, this is a superficial aspect of the posterior aspect of the leg. We have our calcaneal tendon. Our calcaneal tendon is going to be made up of the gastrocs, and then deep to that, the soleus. Here we're actually seeing the gastrocs being removed, and here is the soleus muscle. Directly above the soleus is the plantaris muscle. The plantaris muscle has this small tendon that's running with the gastroc and the soleus to insert into the calcaneus. Okay, the nerve that must be running through here must be a branch of the tibial nerve, because the tibial nerve is innervating all the musculature in the posterior division, or posterior compartment of the leg. Okay, now what I do want to point out is when we go into the deep structures in the posterior compartment of the leg, you have to know the tendons as they're crossing behind the medial malleolus. So if I'm passing behind the medial malleolus, this has to be, by definition, tendons and vessels coming from the posterior compartment of the leg. The mnemonic for this is Tom, Dick, and a very nervous Harry. So Tom stands for tibialis posterior, Dick for flexor digitorum longus, A, artery, very, vein, nervous, nerve, Harry is flexor hallucis longus. So we start anteriorly. This tendon, and again, this mnemonic only works for the tendons. It does not work for the muscle bellies, only for the tendons. So you have tibialis posterior, Tom. You have the second structure, which is your flexor digitorum longus, Dick. You have the vein, the artery, the vein, then the nerve. And then lastly, back here in the back, this is where we're going to have the flexor digitorum, flexor hallucis longus, Harry, all the way down the back. Okay, so look at the structures as they're crossing the behind the medial malleolus. This will tell you definitively it's from the posterior compartment. I see this structure is passing anterior to the medial malleolus. I know that tendon definitively comes from the anterior division of the leg, which means it can only be one of a few muscles. Okay, as I'm coming over here, I'm looking at the lateral aspect of the ankle, or of the leg, and the anterior aspect. So what I want to point out on the anterior surface, there are three muscles. There is the tibialis anterior, there's the extensor hallucis longus, and extensor digitorum longus. So how do I know what these are? Well, the tibialis anterior is going to come down, and it's going to cross in front of the malleoluses. So in front malleolus here, this is your lateral malleolus, medial malleolus. The tendon crosses in front, and instead of going to a toe, it's going to dive down into the side of the foot. That's my tibialis anterior. This next muscle came down, it crossed in front of the malleolus, that told me it's from the anterior division, or anterior compartment, and then it comes to the big toe, extensor hallucis longus. The next one has a similar path, but instead of going to the big toe, these tendons go to the digits of the rest of the toes. This is going to be the extensor digitorum longus. Okay, the brevis, extensor digitorum brevis, and extensor hallucis brevis, those muscle bellies are located on the foot itself, and then the tendons are deep. You can kind of see them in here, but it's a little bit difficult. Next, over here on the lateral aspect, if there is a structure or a tendon that passes behind the lateral malleolus, it tells me it is one of the fibularis muscles. It has to be the fibularis brevis or fibularis longus, because those are the only two muscles that pass behind the lateral malleolus. So if you're passing behind the lateral malleolus, kind of hard to see in this image, it has to be the fibularis longus or fibularis brevis. Okay, so I mentioned, if you're passing behind the lateral malleolus, here's the lateral malleolus. How do I know this is a calcaneus? This is a calcaneal tendon. This is lateral malleolus. If there's tendons passing behind, it has to be the fibularis brevis or fibularis tertis. The fibularis brevis is going to stop on the lateral aspect of the foot, located right here. It also has the fibularis tertis coming in. So fibularis brevis, fibularis tertis. The fibularis longus is this tendon here. It's going to cross the sole of the foot. So longus, brevis, tertis. The tertis is coming from the anterior division, or the anterior compartment. So if it's coming from the anterior compartment, it means that it's innervated by the deep fibular nerve. Okay, now we're getting into areas of the foot. When we're looking at the superficial foot, we're going to say the superficial layer has three muscles. It has one on either side and one in the middle. The structures are the abductors laterally and the flexor in the middle. So you have abductor digiti minimi, okay, located right here, abductor digiti minimi. You have an abductor hallucis. So digiti minimi, abductor hallucis, and then right in the middle is your flexor digitorum brevis. You can see the tendons here. So the flexor digitorum brevis arising from calcaneus, coming down, going to the digits. It is not going to the distal phalanges. It's going to the middle phalange. Remember, the deep, or the flexor digitorum longus is going to go to the distal phalanges, but that is a deeper layer than here. We're looking at the superficial layer here. I identify that once again by finding muscle 1, muscle 2, and then muscle 3 in the middle, which is going to be my flexor digitorum brevis. I'm now one layer deep. I see that we've reflected our flexor digitorum brevis. The tendons have been pulled up. The muscle belly has been pulled backwards. I'm now looking at the second layer. In the second layer, I'm really looking at this tendon, which is the tendon of the flexor digitorum longus, and the two muscles that are associated with it. So the tendon comes down from behind the medial malleolus, posterior to medial malleolus. It comes down into the foot, and it's going to the distal phalanges of the digits. It has a muscle that's located near the base of the calcaneus. This is the quadratus plantae. So quadratus plantae highlighted here. Then coming off of the tendons of the flexor digitorum longus, this is where we're going to have our lumbricals. You have 4 lumbricals, one that is associated with digit number 5, 4, 3, and 2. The first lumbrical is innervated by the medial plantar nerve. Everything else is innervated by the lateral plantar nerve. Okay. Next, if I go one layer deeper, we are now looking at another set of 3 muscles. We have a muscle lateral, we have a muscle medial, and we have a muscle belly, even more medial, most medial on the foot. So this is where we're getting into our flexors. Here we have flexor digiti minimi. So on the pinky side, third layer, flexor digiti minimi. The one in the middle, this is going to be my adductor hallucis. Just like the adductor pollicis in the hand, this has an oblique and a transverse head. Here we're looking at the fibers of the oblique head. So oblique head located here, transverse head is kind of deep in here, coming laterally. So transverse coming across, oblique coming up. Muscle located most medially, that's going to be my flexor hallucis. Okay, flexor hallucis. This is my flexor hallucis brevis. The flexor hallucis longus, if you recall, came from the posterior division, posterior compartment. It went behind the medial malleolus, and the tendon comes down, follow, to the big toe. Okay, that's my flexor hallucis longus. This muscle, flexor hallucis brevis.